Hello friends, today we are going to discuss about borderline personality disorder. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about borderline personality disorder, how to diagnose, prevalence, and management. Borderline personality disorder falls into the cluster B personality disorders. Invariably, the cluster B personality disorders are grouped because of the symptomatology and phenomenology, which clearly says the cluster B means dramatic, emotional, or erratic behavior are well known. Cluster B personality disorders are challenging to any physician, any psychiatrist, and the treating team. If you look at the cluster B, the borderline personality disorder is placed there. Let's understand borderline personality disorder. In borderline personality disorder, they need to have a pervasive pattern of affective instability, that is, mood instability. Cognitively, they should have disturbance in self image, interpersonal problems like intense and stormy relationship, unstable relationship. Behavioral, they will have multiple deliberate self harm and dissociative symptoms. Some of the researchers consider these borderline personality disorders have two subtypes. First one is chronic empty feeling subtype, other one is impulsive subtype. If you look at the four dimension of borderline personality disorder, first and the foremost is interpersonal instability, which has fear of abandonment, disturbed or unstable relationship. Affective dysregulation, that is mood instability, anger outburst, feeling of emptiness. Cognitive and self disturbance, paranoid ideation, dissociative symptoms, and identity disturbance. And finally, the behavioral dysregulation, such as deliberate self harm, suicidal attempt, and impulsivity. Let's look into the DSM 5 criteria for diagnosis of borderline personality disorder. As I mentioned earlier, they need to have a pervasive pattern of instability of interpersonal relationships, self image, and affect. And they also should have marked impulsivity, and these symptoms should be present in most of the context in their life. Invariably, they should have 5 or more symptoms to diagnose borderline personality disorder. Let's look into those symptoms. They should have frenetic efforts to avoid real or imagined abandonment. Second one is a pattern of unstable, intense interpersonal relationship characterized by alternating between extremes of idealization or devaluation. Identity disturbance such as markedly and persistently unstable self-image or sense of self. Impulsivity in at least two areas that are potentially self-damaging, such as spending, sex, substance abuse, reckless driving, binge eating. Recurrent suicidal behavior, gestures, threats, and self-mutilating behavior. Chronic feeling of emptiness is also well known. Affective instability due to marked reactivity of the mood is well known. Inappropriate intense anger or difficulty in controlling anger is well known. Transient stress related paranoid ideation or severe dissociative symptoms are well known, my dear friends. These are the symptoms of borderline personality disorder. Let's look into the prevalence. The prevalence of borderline personality disorder is somewhere around 1.5 to 6%. The comorbid conditions which are well known to co-occur with borderline personality disorder is depression, dysthymia, anxiety disorder, panic disorder, dissociation, substance use, somatization, obsessive compulsive disorder, and eating disorders. Let's look into the management of borderline personality disorder. The diagnosis of borderline personality disorder are striking, and a good clinician can easily diagnose based on the history. However, one need to do detailed evaluation, clinical interview, collecting multiple sources of information, observation will yield for the diagnosis of borderline PD. Projective test can be utilized. Further, various tools can be administered, but it is not an hard and fast rule. A good history from family members, friends, relatives, spouse, and partners can clinch the diagnosis. However, one can administer PI, SCID5, MMPI2, MCMI 3 and PDQ4 can be administered for the diagnosis of borderline personality disorder. Further, specific instruments such as McLean screening instrument for borderline personality disorder severity index can be used. Let's look into the treatment of borderline personality disorder. There are two. One is psychological, pharmacological, and combination of both. Let's look into the psychological treatment in borderline personality disorder. That is psychotherapy. A Cochrane review was done in 2020 by Straub and his colleagues. In this, they reviewed 75 randomized control trial comprising of 4,507 participants. 16 different psychotherapies were reviewed. The beneficial effect of all primary outcomes were noted when psychotherapy was compared with treatment as usual. The pooled analysis of psychotherapy versus waiting list or no treatment found significant improvement on severity of borderline personality disorder, psychosocial functioning, and depression at the end of treatment. But these findings had low quality of evidence. Similarly, there was one more study published in British Journal of Psychiatry by Winterling and his colleagues. This was published in 2022. In this study, they reviewed 31 randomized control trial comprising of 1,870 participants. Among standalone treatment, statistically significant effect was observed in dialectical behavioral therapy. By using dialectical behavioral therapy, they are able to find severity of BBT was decreased, self-harm and psychosocial functioning also improved. With regard to, there is reasonable evidence to conclude the dialectical behavioral therapy is the best treatment for borderline personality disorder. Let's look into the pharmacological treatment of borderline personality disorder. A CNS drug published an article titled Pharmacological Treatment of Borderline Personality Disorder, a systematic review and meta-analysis in 2021. This was done by Gerald and his colleagues. In this study, they looked into 21 randomized control trial and that data included 1,768 participants. 19 RCTs compared pharmacotherapy with placebo, 2 RCTs with treatment of head-to-head, and the evidence indicated that efficacy of pharmacotherapy for treatment of borderline personality disorder is very limited. Low evidence indicates that anticonvulsant and antidepressant can improve specific symptoms associated with borderline personality disorder such as anger, aggression, and affective lability. That means a strong recommendation cannot be given. However, second generation antipsychotics had a little effect on the severity of borderline personality disorder, but they are found to control some of the affective dysregulation. Similarly, a Cochrane review was done in 2022 with regard to pharmacological intervention of persons with borderline personality disorder. Again, this study was done by Winterling and his colleagues. In this study, they looked into 46 studies involving 2,769 people of borderline personality disorder with 27 different types of medication. And these medications were grouped into antipsychotics, antidepressant, and mood stabilizers. Comparing these medications with the placebo or medications, they could not find any difference. That means indicating or prescribing medication for borderline personality disorder do not have a strong evidence base. However, medications can be used in comorbidities such as depression, anxiety disorder, dissociation, suicidal attempt, death wishes, aggression, and impulsivity. That means medications can be used in crisis. However, one need to discuss with the patient before starting medications with borderline personality disorder, my dear friends. However, there are early studies or some studies indicates by providing medication, we can decrease the severity of borderline personality disorder, self-harm, and suicide-related outcome has been mentioned in some studies. Similarly, there was a JAMA which looked into the review of borderline personality disorder in 2023. This was done recently by Falk and his colleagues. In this, they clearly indicated that psychotherapy is the first line of treatment and dialectical behavioral therapy is the best choice for treatment of borderline personality disorder. Psychotropic medications can be used in comorbid condition, but however, There is no strong recommendations to provide medications to borderline personality disorder. However, in crisis, you can use these medications. To conclude, my dear friends, borderline personality disorder has affective, behavioral, and cognitive dysregulation, which causes severe interpersonal problems with loved ones, especially family members and friends. Comorbidities the role in borderline personality disorder, such as depression, anxiety disorder, eating disorder, BPAD, and OCD are common. The presence of borderline personality disorder with any psychiatric condition causes poor course and outcome. And DBT, that is dialectical behavioral therapy, is the treatment of choice in borderline personality disorder, my dear friends. Thank you very much for giving your valuable time. Stay safe.